Thank you to L'Oreal Dermatological Beauty for generously sponsoring this episode of Dermatology Undressed, a provocative podcast. L'Oreal Dermatological Beauty had no influence on the selection of the faculty nor the content development. This podcast is for educational purposes only and is not medical advice. For personal medical care, please consult a qualified healthcare professional. Welcome to another episode of Dermatology Undressed, a provocative podcast. I'm Dr. Lindsay Ackerman. Today, I am so honored to bring in Dr. Klint Peebles, a board-certified dermatologist and incoming president-elect of the DC Medical Society in our nation's capital, Washington, D.C., also serving on the board of the LGBTQ+ Section Council at the American Medical Association. Dr. Klint Peebles is a powerful voice in advancing health equity in the LGBTQ+ population. He will talk about implications of hormone therapy to navigating structural bias in healthcare. We are going deep today. We're going to explore an unadulterated story of identity, resilience, and advocacy. Let's get beneath the surface, Dr. Peebles. Thank you so much for joining me today.
Thank you, Lindsay. I'm so happy to be here. Thanks for having me.
Yes, I adore you. I love you. I think you are doing amazing, amazing things. And before we dive into all of the incredible work you have spent your career really dedicated to, moving the needle forward in the experiences for our patients that are in marginalized communities, specifically the LGBTQ+ communities, I want to actually take a step back and ask you to just share a little bit about your own journey, if you're comfortable to do so, both personally and professionally, that led you to become this advocate for LGBTQ+ inclusion within the dermatology scope of medicine, but also moreover, just in the overall house of medicine.
Well, there's not many more people I'm more comfortable with talking to than you, so I'm very happy to share. And of course, first I want to acknowledge that everyone who identifies as a member of the LGBTQ+ community has a unique story and lived experience, right? And all of those stories need to be told, and all of us can learn from all of those experiences. That being said, though, I grew up in rural Mississippi, where I saw firsthand the challenges someone faces simply by being different and growing up in a space that doesn't quite work for them. I struggled throughout grade school, experiencing depression, anxiety, all the other challenges that one would expect to face in similar circumstances. And I finally came out in college, although that came with its own set of challenges. At that point, though, I did feel liberated and finally happy in my own skin. And I really wanted to be sure that others got that chance too, to feel that way. The earlier in life, the better, right? This needs to be something people are comfortable doing in childhood, is coming out if they so choose. We all have limitless potential when we're allowed to channel the fullness of our identities, and there's also great power in community. So advocating for those issues in my local communities and in the field of medicine more broadly seemed like a natural fit. And during my training, I also saw firsthand how heteronormativity and cisnormativity are pervasive and how discrimination against LGBT individuals is more common than one might expect, and that healthcare spaces aren't necessarily safe or comfortable for neither physicians nor patients. During my internship, I was even asked by a patient to leave their room and to not participate in their care when they came to the conclusion that I was gay. But I've also seen the joy that comes to folks when they feel seen and heard, when they feel validated, when they feel affirmed, when they're able to connect with someone else who understands them and wants to see them succeed in living as their authentic self. And amid all of the social backlash that we're seeing, I still have a lot of hope. This year we've seen hundreds of anti-transgender bills in state legislatures across the country, a Supreme Court decision upholding bans on gender-affirming care for minors, a slew of executive orders seeking to limit basic freedoms of LGBTQ people in one way or another. And more recently, a case that will be pitched to the Supreme Court seeking to overturn same-sex marriage equality. So we are seeing such a onslaught of just not great events that are really threatening the fabric by which so many people are living. And I think it's more important than ever that we have this conversation. And my experiences have informed that, but I also recognize that we all have our own experiences and ways that we've gotten to where we are now.
I thank you so, so very much for being so broad and comprehensive in your answer, Dr. Peebles. It is um, sort of an overwhelming reality that I know you and I appreciate very, very much. And I wanted to do this particular podcast again because it's for public consumption, because there are, by definition, going to be a lot of people that naturally may just say, "Well, why does this even apply to me? Why should I listen? What matters about this?" And, we can take it to a myriad of historical circumstances that have existed across our planet where if they sort of weren't coming for me, well, why do I care? But maybe they're going to come for you later. And maybe it never matters if they come for you, right? If we are all inhabiting this planet together, isn't there just a role for everyone to understand how important it is that patients of the LGBTQ plus population are able to access medical care? I mean, it's something that is just so foundational we take it for granted that, oh, we're in the United States, everyone can get good care. But for many, there is still this enormous gap between what feels right, what feels inclusive, what feels affirming, and especially in the light of the onslaught, as you mentioned, of so many policies being tossed around or policies being frankly implemented that create a greater degree of ostracism from what you could argue is an already ostracized population. So as physicians, we like to think that with great privilege comes a tremendous amount of responsibility, and that is why I'm bringing this up today. I think we have to be vocal and verbal and say, and this is discriminatory practice if we are not approaching patients where they are. We would do it for anyone else, and why we allow for such health disparities is really, really very, very concerning and problematic. So, on that note, tell me a little bit about where you see the most pressing sort of dermatologic, but overall health disparities affecting the LGBTQ plus populations today.
Yeah, so it's an interesting question and something we're learning a lot more about. And as you mentioned, at the end of the day, all of this is about people, right? People who simply want to live their authentic lives and be validated and affirmed. But yet we know that LGBTQ people do have unique disparities. And in terms of those, we know that 20% of LGBTQ people overall and almost half of transgender people report experiences of discrimination in the healthcare system. Poverty disproportionately affects LGBTQ people who are more likely than non-LGBTQ folks to be unhoused and less likely to own their own homes. Those disparities are even more greatly amplified for LGBTQ people of color. If we look specifically at transgender youth, compared to their cisgender peers, they're at 2 to 3 times increased risk of anxiety, depression, and suicidality. 2 to 4 times increased risk. Yeah.
I'm sorry, I'm going to actually introduce just a question on that because I think that this brings up a whole nother angle to what we're talking about. And that is, the more we normalize, right, where people are, who they are, what they believe, the less offensive sort of it becomes to the norm. So, to what was classically considered the norm. So, the more we normalize who these people are, we appreciate the individuality of every person. Do you think that there's a potential? We have this this social dynamic that you mentioned where these patients are more likely to be homeless. They are even more likely to be homeless if they are a skin of color and they happen to be LGBTQ plus. Does that stem? I mean, you touched on your history of growing up in a place where you were not accepted for who you were, and it was a major challenge and impacted your life in ways that caused mental illness, depression, anxiety. Do you think that the more we normalize this population, who they are, we appreciate them, we embrace them, that perhaps we take away some of the stigma that families necessarily feel as though they need to hide or that they disapprove of? Because culturally, we've made it okay to disapprove of these people. And if we instead normalize it and give them give their families a place to feel comfortable, if people are asked when they go into a doctor's office how they, would prefer their pronoun, right, or who do they see their pronoun as being, do we normalize it in a way that allows the parents to accept who they are more easily and maybe mitigate these downstream effects of social constraints that lead to lack of home ownership or poverty or other impacts that we're seeing?
Well, I think the shortest answer to that question is yes, for sure, right? I mean, the more that we as a society acknowledge the reality of all these diverse experiences and identities, that goes a very long way. And I think case in point with that, when you think about the differences between treatment of, for example, gay individuals versus transgender individuals over the last several decades, one of the interesting inflection points was that when marriage equality was passed by the Supreme Court in 2015, almost 90% of the American public reported knowing somebody who wasn't heterosexual, and more than half said that they had a close family member or a close friend who identified as gay or lesbian. Now, compare that with the number of Americans who report knowing a transgender person today, which is only about a third to just under half of US adults at best, right? So, and specifically when these surveys look at non-LGBTQ adults, that awareness rate is about 20%, right? So we have many people who do not know and are not familiar with transgender people who have not been exposed to people who are out about their gender identities. And so that human connection is really pivotal in terms of swaying public opinion, normalizing, to your point, as far as what these attitudes are and how we integrate other people who may not have the same experiences and background as us into our everyday lives. And so we know that that has a huge bearing. And we know that in some ways, we're seeing that happen. LGBTQ identification is ticking up in this country year by year over the last decade at least. And part of that is due to more widespread social acceptance. Now, despite some of the kind of, steps we're taking backward right now in the policy space, it's still something that people are feeling more open about, talking about, more visibility is happening. So we're seeing definitely a groundswell in terms of the people who are able to be open about their identities, but we also need our policy spaces to catch up at the same time.
Yeah, and it's kind of like a logarithmic growth curve, I imagine, right? The more people are out, the more people feel comfortable, the more people are out and open. And, acceptance is everything, right? We all want to walk through this journey in life and feel as though we have a place and a space and that we're free to be, as you say, our authentic selves. So I know I digressed a little bit, but I didn't want to not focus on how broad this overall theme really is to treating people well. And again, we have the privilege of being physicians, and with that comes responsibility. And I think we need to give visibility to this as a whole. But as we do digress into dermatology, I want you to comment on what you think are those dermatologic conditions, skin conditions you've observed to be more prevalent or underdiagnosed or maybe misunderstood amongst the LGBTQ plus population.
Yeah, so the first point I'll make is that just because an LGBTQ person comes into a doctor's office does not mean that they are there about an LGBTQ thing, right? They are at the end of the day, just like everyone else, have the same issues, same conditions, same healthcare needs in many ways, but they also have unique needs too. So the main point that I'll emphasize over and over again is you just can't make assumptions, right? You have to ask the right questions, know what's bringing the person in, what their background, what their experiences are, what their behaviors are in order to know how best to treat them, right? But
So I want to underscore this. It's like I want to underscore what you just said and just saying it's like you would take any medical history. You need to understand what medications they're on, what their experiences have been, what other medical conditions do they have in order to treat them as a human. So independent of, gender, sexual orientation, anything, they're just another person in some ways. But as you also say, with unique needs.
yeah, absolutely. And just for as a handful of those, so some conditions that are more prevalent in these individuals would be, first of all, HPV related disease, the human papillomavirus, so higher prevalence of anal genital warts, anal cancers in men who have sex with men, and in individuals living with HIV infection. Skin cancer is another big one. There's an increased risk of melanoma and non-melanoma skin cancers, especially in gay and bisexual men. And we think that that has something to do with higher rates and engagement of indoor tanning. But there's still more to learn about that. And certainly conditions that are underdiagnosed or delayed. I mean, you have the all too familiar condition of hidradenitis suppurativa that we're seeing. So this is more common in sexual and gender minorities. Some sexual and gender minorities often worsened by obesity, smoking, sometimes testosterone therapy, all three of those of which have higher prevalences in these populations.
I'm going to just interrupt one more time here because
Yeah.
you do know me well enough to know that I have an enormous interest
Yes.
scientifically in hidradenitis
Yes.
suppurativa and a
Yeah.
great degree of passion in treating these people well. They, you know, the affliction of their disease is so robust: pain,
Yeah.
malodor, burning,
Mm-hmm.
stinging, and they're forming these abscesses and nodules and sores that drain pus from incredibly intimate and sensitive areas. So from the axillary region, which is the armpits, under
Mm-hmm.
the breast, the groin, the buttock. And you you mentioned something, and you said, of course, in those that are gender minority, in those that are skin of color, we also know that in this particular population that struggles with hidradenitis suppurativa, there is an overrepresentation of depression
Yep.
that is
Mm-hmm.
significant, meaning major depressive disorder. And you also have to wonder, in some ways, how
Mm-hmm.
patients that are coping with the stigma of their LGBTQ plus,
Mm-hmm.
status in a system that doesn't necessarily embrace them, and how much of a greater impact that may have in potentially even leading to obesity. The chicken and
Yep.
the egg question comes up with obesity and this disease. Is it a coping mechanism that food becomes a pacifying coping mechanism for them, or is that obesity is actually driving the disease? But again, when we holistically look at just trying to take care of a human, a person, and not a
Yep.
disease state, this is why recognition of who these people are and giving affirmation to them matters so much, because it literally can drive disease.
Yes. Yes. Well, and that, that's all within that minority stress framework, right? Where stigma actually intersects to impact all the downstream factors of healthcare, which we can certainly talk about. But, I think that, case in point, when we're thinking about a specific example of treating acne, and let's say a transgender person who is taking testosterone, and testosterone certainly causes a huge increased risk of acne. And, when people have severe acne, they may need a medicine called Accutane or isotretinoin, which actually has some warnings about depression and even suicidality in some cases. A lot of that's been debunked, but that's another conversation. But, a lot of people get a little bit spooked about that when they have to use medicines that may carry risks. But to that point, I will always say, well, show me an LGBTQ individual who has not experienced depression or anxiety. And the vast majority of transgender individuals that come into my clinic have considered suicidality or have had suicidal ideation in the past, which is just a horrible thing to understand how pervasive that is. And
That's
so,
that's a that's a huge, I mean, what you just said.
yes,
And you
yes.
take care of these patients day in and day out. You are their ally, their friend, their counselor, meaning in the medical sense. And you're saying
Mhm.
that nearly every one of your LGBTQ plus patients have openly shared with you that they have experienced thoughtful suicidality. I mean,
Correct.
that's overwhelming to me to think about.
Correct.
I mean, if we
It
if we were
is.
to attribute that statistic to someone who is black, right? And we just said if
Yes.
every black patient that walked in the office had thoughtfully contemplated suicidality, there would be, I mean, this would be game changing in healthcare, right? We would have to do
Yep.
something.
Absolutely. Well, and let me tell you, I mean, this is something that everyone listening should take away. Transgender people are more than 60 times more likely to attempt suicide than the general population. That is a sobering statistic, but studies consistently demonstrate again and again that gender affirming care reduces that risk by more than 70%, right? So, this is where we have a strikingly remarkable tool in our toolbox of helping to save lives, and that is simply by providing the most basic of care, which is gender affirming care. So validating, recognizing, affirming someone's identity, and everything that comes along with that in terms of the healthcare that we provide. So, it is a huge problem, but it's something that's all too familiar to this population. And we have to make sure that we are assessing those risks in light of the benefits that we can provide and not let that be a reason that we withhold care from
Right.
transgender people who so desperately need it.
And you bring up such an enormously important point. Statistically, looking at the actual mitigation of risk in this particular population, right? When we take that Hippocratic oath to do no harm, and it's very easy for us to say undertreating disease is doing harm. If we have a tool we knew could reduce someone's risk of a heart attack by 70%, I mean, we would be at fault of medical malpractice for not providing that patient that particular intervention. And yet here we have an entire population where we are arguably seeing the highest risk of thoughtful suicidal ideation in any given named population, the LGBTQ plus population, then subspeciating out the transgender population and having a 60-fold increased risk where we can reduce that risk by 70% with gender-affirming care. And we're withholding that in several arenas. And, I'm not here to necessarily change policy, right? But in order to move the needle, which ultimately will need to happen for policies to be appropriated according to the medical needs of our public, we have to have the general public understand how important this is. Because when it's, doesn't apply to me kind of thinking, we just lose as a society. We really do. So thank you. Thank you for commenting on that. I'm going to ask you to shift just a little bit into gender-affirming language, especially around pronouns, maybe anatomy or identity. Obviously, it matters to us in dermatology. I think it matters greatly in the House of Medicine, just in culture at large. Can you just speak to that for a moment for me, Klint?
Yeah, so affirming language is really foundational to trust, right? When a patient hears their pronouns respected, their identity acknowledged without hesitation, it's a strong signal. It's a signal that they are safe and seen and valued. And in dermatology, that's especially important because we're often examining and looking at and discussing highly personal areas of the body, among other things. And, using affirming language, it not only reduces the risk of alienating or re-traumatizing patients, and this population has undergone extensive trauma usually, but it also directly impacts, clinical accuracy, right? If a patient doesn't feel comfortable, they may withhold critical information about their symptoms, about their treatments, about any other aspect of their history. And so it's not about political correctness, right? It's about delivering better, safer, and more complete care. And I always point out too, even if you are identifying as a cisgender person, if somebody uses the right pronouns for you, that is still gender affirming care, right? It is
Exactly.
not something that is unique to the transgender population, right? Because it's about validating and acknowledging someone's gender identity no matter what it is, right? And
Right.
that's core to this concept of gender affirming care, which sadly is a term that has become weaponized and politicized. That's a conversation for another day. But ultimately, again, to reiterate this point again and again, this is about humility and about respecting the person that's in front of you.
It's respect. And what is more important in the practice of medicine, if your main interest is just getting patients from whatever ailment it may be into greater degrees of wellness, there is no part of this that's a unidirectional experience, right? This is no longer supposed to be the paternalistic practice of medicine where you walk in a room and you shout at somebody that you're going to do this or we're just going to do that, or you say, "Oh, you look great," and you're done and you leave. No, this is a relationship that we carry together, this very privileged relationship. And how better to get someone to actually do well, to make you look good as a doctor, right? To actually have a good health outcome, than having a sense of mutual trust and respect And when it comes to, quote unquote, we like the word compliance in medicine, which really just means that when we agree on a particular treatment modality, the patients are actually able to go home and execute that treatment as discussed in the privacy of their own home and come back having done what, we all agreed we would do. That compliance piece is so much more likely in the setting of a relationship where there's mutual respect, right? If you're talking to somebody in a way that they don't feel respected, why are they going to go home and actually kind of do what you suggest or ask them to do?
Right, right.
So
Absolutely. I
I
mean,
see it.
right. Yeah. Yeah. And you have to remember too that, a lot of these individuals, they are coming to you more likely than not having had a negative experience already, right? These are not just presumptions. These are not, unfounded fears that they have about the healthcare space. This is lived experience, right?
Absolutely.
Chances are they have already had that negative experience that either traumatized them or made them more averse to seeking healthcare. And this is borne out again and again in survey after survey. So I think it's a really powerful thing when we, as physicians in the healthcare workforce, have the ability to stop that in its tracks and rewrite that narrative for that person on the spot. Right. And with one
Absolutely.
gesture, it
And
takes one inclusive intake form. It takes one usage of the right pronoun. It takes one instance of validating their identity to fix so much harm, or at least to build upon that in a way that's going to make them more successful in their own healthcare.
and hope, right? I mean, I think philosophically, if we are to actually think of, kind of like the world's on fire around us, all the time, there's always so much to juggle. And now maybe really, truly more than ever in healthcare.
Yes.
But the two things that we own, again, with this tremendous privilege we have, that we own in this space is hope and gratitude, right? We we like you just said, in this one moment when we acknowledge and affirm who someone is just by the simplicity of using a pronoun that they find that they find commensurate with their own identity. When we endorse them that way, we've changed their whole movie reel, right? In that snapshot in time, we can change their movie reel experience so that every future potential encounter and maybe realized encounter in the future is experienced in a different way, where they can walk in feeling hopeful, feeling optimistic potentially about what this is going to be. Maybe they feel even confident if the correct pronoun isn't used to sort of navigate the conversation and ask for the appropriate pronoun to be used, where before they felt powerless. And in turn, by giving patients that degree of hope, which is a really easy thing for us to just respect who they are, in turn, they will be paying us back in droves with gratitude. I mean, those um, moments happen for us in the exam room where we walk out feeling like, wow, it took no more time. It didn't take medical expertise that I had to go reading in a textbook. I just affirmed who someone is. And look at how grateful they were to be able to be in that safe space. So I
And I
can't
think,
speak
yeah, one
enough
of
of
the
that.
most powerful moments for me as a doctor that luckily I get to see quite often, given the population that I work with most frequently, is that moment when you can absolutely see the guard come down, right?
Hmm.
When that they are braced to be hurt, braced to be offended, braced to be non-affirmed, invalidated. And when that doesn't happen, and actually the opposite, for whatever reason, whatever you're doing, um, you know, to see that look of ease, of comfort, of just being at peace with the space and the situation, it's a really powerful thing.
It
And
is.
it's something that I think everyone would love to see more in their practices.
And sometimes it's like the simplest of things. Whether somebody is LGBTQ plus or not, we understand what it is like to come into a room and have someone feel guarded. You can tell there's body language, there's
Absolutely.
stuttering to their tone and their cadence and their voice. Um, it's a different feel than when someone's totally relaxed and at ease. And I mean, the simplicity of grabbing their hand or, I'm a hugger, So leaning in and giving someone a hug and saying, "Hey, it's so nice to meet you. Welcome to the practice. I'm Dr. Ackerman. How do you prefer that I refer to you?" Or whatever it might be. It's like that that tension that existed in the room just totally goes away. And it's such a much more fun experience to share the space with that person who's then openly free to be who they are and allow me to be a better doctor, frankly.
Of course.
Yeah. So I want to ask about challenges and resistance. You've been in this space for a long time. The space it's kind of been like a pendulum, gone back and forth with various different degrees of acceptance and lack thereof. Can you tell me, what you would say are some of the bigger challenges you've encountered in the actual advocacy work you're doing and how you stay motivated? I mean, this is a tough, tough time. How do you stay motivated to do all this advocacy work for the LGBTQ plus population despite the obstacles?
Yeah, and every bit as much as I do that advocacy of any stripe inevitably involves resistance because at the heart of it, you're asking systems and institutions to change, right? And
Yep.
change does not come easily, and often in ways that challenge these entrenched interests or longstanding biases. And in my work, I've faced everything from overt pushback in legislative hearings to more subtle resistance in healthcare spaces, like colleagues who were hesitant to speak up or institutions that frankly move too slowly. And these moments can feel really discouraging. But I remind myself that resistance means simply that you're pushing on something important, right? And I've learned to be strategic,
I like
collaborative.
I want to pause because I just love that. Resistance means you're pushing on something important. Nothing has ever been done historically that was meaningful that didn't take resistance against, pushing against something that was important.
Yeah,
That,
yeah,
yeah.
and you think about the history of the LGBTQ movement in this country. You think about the dawn of the gay civil rights movement at Stonewall decades ago that really started because of brave transgender individuals and drag performers, right? Like Marsha P.
Hmm.
Johnson and all of these other noteworthy individuals who have been largely erased out, because of discrimination. But they were pushing against the status quo because they knew it was the right thing to do. And in many ways, that's what we constantly have to do. As bad as things get, we have always come from that same amount of resistance. It's just a different flavor of it now. And I think it's important to build coalitions, and so that no one bears that weight alone. Progress is never immediate; it's incremental. We build it over time. But knowing that patients' lives and futures are improved by even these small, minutest of wins, it really keeps me grounded and motivated even amid the setbacks. And the work is heavy, especially when you're advocating for communities that have been historically marginalized. And especially, it's not as if we're just continuing this year to just climb up the hill, right? We're actually kind of slipping down the hill a little bit,
Right.
and that can be really
I think we're actually
demoralizing.
being pushed down the hill. Actually, we're not.
Correct.
Yeah.
Fair. Yes. 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 Thrown down the hill. Right. It's
Maybe.
an
Yeah.
avalanche. Right. Right. But I think it's all the more important to find that balance, right? Because this is a snapshot in time, and you have to have that connection, that perspective, and just find the joy, in what you're doing and celebrate that incremental progress rather than being
Yeah.
paralyzed by the setbacks, right?
Yeah.
And you have to plug into what's meaningful and important to you because you can't do the work alone, and you can't do the work when you're not mentally prepared to do the work. So it's important to take care of yourself and those around you.
Yeah. And it's true. We're seeing a lot of burnout in medicine. A lot of physicians are retiring early. They're seeing fewer patients. They're at dis-ease in the healthcare space in which they practice. And yet I can't help but also, again, with hope, uh, mention that that analogy of the small boy walking on. I'm going to get this probably a little bit wrong, so forgive me, but walking along the seashore, and the shells are getting swept up by the tide, and they're getting they're being placed on the sand, and he continues to walk and throw every shell back into the sea, and someone says they're just going to get swept back up again, and he says, well, but maybe not this one, right? It's going to matter to this one. And uh, the caveat to us being, trying to walk uphill in the middle of an avalanche, at some times though, is just so grounding and easy to feel privileged and happy and optimistic when it just is one encounter you share with a person where that guard just came down, or you did something in the advocacy space where you spoke to a legislator and made, a small degree of thought happen that wouldn't have otherwise happened, recognizing you're not going to turn a 180 in a moment, but that there's now some groundwork that you can build momentum on in the future. I think it's important that we remember that, not every day is going to be spent winning the war, but we've got to continue to fight the battles. And in the end, if we do so appropriately based on what we know it to be right, that ultimately we will win the war.
Well, and to that point, I think something you've been talking about the whole time, or at least referencing, is, part of the reason that burnout is at an all-time high is because we are seeing ourselves pushed further and further away from the practice of medicine that we want it to be. And namely, that's making those human connections and having those heartfelt conversations with the patients in front of us. And at the end of the day, that's what this is all about, right? This is
Right.
understanding those lived experiences, understanding where they've come from, understanding how we can help get them where they want to be. So, these kinds of rewarding conversations is really what this field of LGBTQ healthcare is built on. And so, in some ways, it's actually been incredibly therapeutic in terms of mitigating my own sense of burnout. It's not just that I'm interested in it, it's not just that I resonate with it, but it's also that I am able to have these really substantive and rewarding conversations with people who are just so desperate to share their stories, right? I think it was Oprah Winfrey at some point who said that, everyone has a story that needs to be told, right? And
Yep.
the more that you solicit those stories, the better off, we're all going to be, right? Because
Right.
everyone needs to get their story out because we can all learn from each other.
So for the listener that identifies with the LGBTQ plus population or someone who is an ally of someone of the LGBTQ plus population, give me just a tidbit of what they may be, the listener, taking home from this conversation today about how they can better advocate for themselves the next time they're in a visit with a physician or healthcare provider and they feel like they need to be seen or more visible, from an identity perspective. Um, how would you suggest that they approach that particular gap?
For patients, I think, there are a lot of resources out there that really kind of seek to show where you can find affirming physicians, affirming healthcare professionals who have committed to creating a safe space. And
And
some of that you can find on the GLAMA, or, the Gay and Lesbian Medical Association. That was how it was formerly known, but now it's GLAMA, Healthcare Professionals Advancing LGBTQ Equality. They have a great database that shows all of that by region. And other sources just like it, where you can find information about
yeah,
where, those safe spaces may exist.
I think there's a lot of grassroots done by this population as well, that they have found a way to support one another. I mean, I had a patient not too long ago show up and tell me that they chose me to be their dermatologist because my name came up on some blog that I was friendly to the LGBTQ plus population. I was like, oh, I didn't know I was on a blog. Well, you were mentioned several times. Oh, okay. It was their blog. Yeah, and I found that to be great. It's networking and really, so oftentimes from grassroots that many of these changes actually happen. So,
Yep. And
you know,
that was my next comment actually, is that, historically, because access to quality healthcare and safe spaces has been so limited, a lot of the time individuals have been forced to create their own spaces and to find their own healthcare and to kind of create their own communities where they can get care that they might not otherwise receive in conventional healthcare spaces, right? And so, to your point, a lot of these support groups and blogs and online forums, they are all incredibly valuable. And in fact, those are often the spaces I go to when I want to learn something new, when I am looking to understand something going on in the community that I didn't
Wait a
know
minute. You
about
don't know
before.
everything? That's surprising
That
to me. Hold on.
I know very little. No,
No.
but and that's actually how it's. So for instance, one thing that I'll mention is this concept of chest binding, right? When a transgender person wants to create a flatter chest in order to affirm their gender identity. So most typically, that's going to be a transmasculine individual. And so I actually looked on the blogs and forums to figure out how people were doing some of these binding practices and how I, could provide, some good kind of tips about how to do that
Resources.
safely. Yep.
Hmm.
But I also found resources in terms of how to get them low cost or free professional binding garments, right?
Wow.
And of course, I wouldn't have known about that in any other way, aside from kind of going into those spaces and kind of working, to figure out, how they're getting the care they need, right? Because of that discrimination, because of that marginalization, they have had to, create their own solutions. And hopefully that's going to be less and less necessary moving forward.
Right.
But, it is
But
something, a great infrastructure.
And it has to start somewhere, right? So again, even us as dermatologists, like you say, doing the homework and learning about this and sharing it with another patient that then can share it with their local community. There's a lot of momentum to be gained by working together in this regard. So I know we've gone through a lot of information. We are dermatologists. That's our subspecialty. That's what we wake up and breathe and do every day. Specifically, as we're getting toward the end, I want to give you an opportunity and ask what gives you hope right now in dermatology as it relates to LGBTQ plus health and equity, and how can we lead in dermatology in providing, what the next iteration of this health equity needs to look like?
Yeah. Well, in general, I think what gives me the most hope is this growing recognition within dermatology that LGBTQ plus health is not a niche issue, but it's a core part of delivering comprehensive and especially patient-centered care, right? We're seeing more trainees asking the right questions, more curricula inclusive of LGBTQ plus topics, more research trying to explore how sexual orientation, gender identity, and social context shape dermatologic health. And that shift matters because visibility is that first step, and it's an incredibly transforming step toward equity. And I'm also encouraged by the way patients themselves are driving change, right? Being more open about their identities and advocating for this affirming care, holding us accountable as physicians. And increasingly, you see that institutions are listening, right? They're paying attention. There's still a super long road ahead. So many setbacks this year, and more to come, I'm sure. But the fact that we're talking about these issues at national meetings and our academic literature and in everyday practice, the fact that you're doing this is a sign of real progress, right? And it gives me hope that that next generation of dermatologists is going to be even more prepared than we are. And that if we nurture that, I really think it's going to build a future where dermatology is going to be a leader in equity and inclusivity. And I would be remiss if I didn't point out, too, that the American Academy of Dermatology passed a position statement on LGBTQ health and dermatology in 2019. And
Mhm.
dermatology at that point was one of the first specialty societies in the country to do that.
Yep.
And we've kind of been a trailblazer ever since. And so I think that, that's really what gives me hope despite all of the setbacks that we've seen, which I'm not even going to call them setbacks. I'm just going to call them challenges that we have to rise above, right?
I
So I think that there's plenty of reasons for optimism.
I could not agree with you more, and I think that last piece that you just offered our audience is the perfect place to take this to conclusion. You have summarized so beautifully, which is again why I just could not wait to bring you on to the podcast, Dr. Peebles. Exactly what it is that we've done, and yet where we still need to go, and that we're nowhere near close to being done. But we need everyone to play a part in this movement. We really, really do. So thank you again. That was Dr. Klint Peebles helping us understand the profound impact of dermatology when practiced with inclusion, affirmation, and awareness. As we continue to listen, learn, and advocate, may we remember that the skin tells a story, and it's up to us to listen. Don't forget to subscribe, rate, and share this episode of Dermatology Undressed, a provocative podcast. Until next time, stay curious, stay kind, and keep peeling back the layers.